With over 2.4 million confirmed cases worldwide and an astounding 171,000 deaths at the time of filming this video, COVID-19 has been a hot topic whose discussion never ceases. Today, we're going to talk about those who are at risk of contracting it, the symptoms associated, its effects on the body, and possible treatments. So, what is COVID-19? COVID-19 is a new strain of coronavirus that was first identified in the Wuhan province of China. According to the clinical and epidemiological features of the emerging virus, COVID-19 is likely to have originated in animals, and the transmission from person to person is extremely common. People with COVID-19 experience a course of illness that generally ranges from mild to moderate symptoms. Some people, however, are more susceptible to this disease. These at-risk groups include older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes, and those with suppressed immune systems. Infants who have not yet developed a strong immune system are also susceptible, that along with people with moderate to severe asthma. This brings me to my next point, COVID-19 and the respiratory system. Active viral replication occurs in the upper respiratory tract. When people with COVID-19 develop a cough and fever, it is a result of the infection reaching the respiratory tree, the air passages that conduct air between the lungs and the outside. The lining of the respiratory tree becomes injured, causing inflammation. This in turn irritates the nerves in the lining of the airway. Just a speck of dust can stimulate a cough. But if this gets worse, it goes past the lining of the airway and goes to the gas exchange units, which are at the end of the air passages. If they become infected, they respond by pouring out inflammatory material into the air sacs that are at the bottom of our lungs, and we end up with pneumonia. Lungs that become filled with inflammatory material are unable to get enough oxygen to the bloodstream, reducing the body's ability to take on oxygen and get rid of carbon dioxide. That's the usual cause of death with severe pneumonia. In these cases, critical care doctors turn to mechanical ventilators that push oxygen into the lungs at a preset rate and force. One of the leading causes of death in otherwise healthy patients is cytokine storm syndrome. In order to talk more about it, we need a little more context. The immune system has cells called cytotoxic T cells. These cells release a chemical called cytokine in order to neutralize foreign bodies entering the system. In cytokine storm syndrome patients, the immune system overreacts and not only attempts to kill the virus, but also the healthy cells in the body. This leads to acute respiratory distress and multi-organ failure. We know that during severe infection, heart function may decrease. Sometimes this decrease is a consequence of systemic inflammatory response to infection, and occasionally, in some people, because of direct viral infection in the heart. There are two dominant cardiac issues related to COVID-19. Heart failure, when the heart muscle doesn't pump blood as well as it should, and arrhythmias, or abnormal heart rhythms, that can be related to the infection or to the effective medications used to treat the virus. Heart failure can develop due to a systemic inflammatory response to the infection, high lung pressures from lung damage, or occur from heart inflammation known as myocarditis. For older patients with existing coronary artery disease or hypertension, it is likely that the heart failure resulting from the increased demand placed on the heart and the body's already decreased cardiac reserve capacity. Now let's talk about the signs and symptoms of COVID-19. Symptoms of COVID-19 may appear 2 to 14 days after exposure and can include fever, dry cough, shortness of breath or difficulty breathing. Other symptoms include tiredness, aches, runny noses, sore throats, headaches, vomiting, and more. Some people have experienced the loss of smell or taste. The severity of COVID-19 symptoms can range from very mild to severe. Some people may have no symptoms at all. Now, let's talk about the treatments associated with COVID-19. While some Western traditional or home remedies may provide comfort and alleviate the symptoms of COVID-19, there is no evidence that current medicine can prevent or cure the disease. To date, there is no vaccine and no specific antiviral medicine to prevent or treat COVID-19. Doctors have relied on antiviral medication, steroids, and other medication to treat the symptoms of the virus. The coronavirus is a serious disease that is on the rise. It currently has no cure and has infected over 2.4 million people around the globe. The most effective ways to protect yourself and others against COVID-19 are to frequently wash your hands, cover your cough with the bend of an elbow or tissue, and practice social distancing. I sincerely hope that everyone stays safe during these difficult times and that we as a society come out stronger than ever.